Welcome back to MedWatch. They're cute, cuddly, and so much fun to hold, but those newborn babies do not come with instructions. For new moms, trying to get a baby to breastfeed can be exhausting, especially if there are medical problems involved. However, a unique relationship between community medical centers and UCSF Fresno offers new mothers and babies the advice, support, and medical intervention they may need. For new parents Michael and Mary Bailey, breastfeeding is part of keeping baby Megan healthy and happy.
This is my fourth child. I work at home. I would have had every excuse to stop breastfeeding and just simply go to formula. It would have been much easier for me to do that initially.
Mary made the commitment to breastfeed since breastfed babies are less likely to develop allergies, have fewer infections, and are overall in better health. But the experience didn't start out as well as Mary had hoped.
I was nervous about breastfeeding, but I was encouraged to keep breastfeeding along for all my other babies. And so when I had Megan, I had problems immediately, right away. And it had been 8 years between my last baby and Megan. So it had been a while since I've been breastfeeding, but I thought I was old hat at this. I'd done this, this is my fourth baby. I should have no problems doing it, and she didn't gain weight.
Concerned about the baby's weight and with Dad's support, Mary went to Community Regional Medical Center's Mother's Resource Center and UCSF Fresno's Center for Breastfeeding Medicine.
We had already started the process with the Mother's Resource Center, so we went immediately back in there and they got us in to see Dr. Evans. And with the one-on-one coaching that we got from Dr. Evans and from the Mother's Resource Center, going in every other day, just working with them, she gained her weight.
Go ahead and have a seat. Let's see how things are going.
At the Mother's Resource Center, new moms first meet with lactation consultants for advice and support.
Good. Sleeping through the night.
If more help is needed, or if the mother or baby have a medical condition, they are referred to the Center for Breastfeeding Medicine.
A very unique center in that we can help mothers with complex medical problems that impact breastfeeding. We can also address problems that are more related to the baby, such as cleft lip and palate, tongue tie, other such things that can impact breastfeeding.
I see some whiteness on his lip. We think about why there's a problem, and then we try to work with that condition and try to alleviate it. We do medical interventions, we do all sorts of hormonal interventions, we treat infections. So a lactation consultant may notice a problem with an infection, but we are able to treat it since we're physicians.
With medical doctors close by, it's easier for moms and babies to get the immediate help they need.
14, 13.8, so he's doing really, really well. It's really hard if a mother has a problem to go make 2 appointments, one with her doctor and one for the pediatrician, around something that could be treated with somebody who feels comfortable treating the mother for certain conditions and the baby with certain conditions.
The doctors say they opened the center because they saw a need in the valley to promote breastfeeding more as the first choice for babies' nutrition.
Taking formula and using bottles is so much more expensive, number one up front, and number two to society, because if you can just give the baby what nature made for the baby, it's so much more preventive to the baby. It's also good for the mother.
Since it is a teaching center, new physicians are learning firsthand about breastfeeding medicine.
It's an L3 drug.
The new physicians will take with them what they learn about mothers and babies.
We are able to work with our residents and our medical students and basically teach the doctors of the next generation all about this new subspecialty of medicine, and enhance promotion of breastfeeding, and also allow them or teach them how to work with common breastfeeding conditions.
The Center for Breastfeeding Medicine takes referrals and consults with physicians and hospitals from around the region. Once a patient leaves the center's care, the doctors hope the breastfeeding experience continues to be positive and beneficial to both mother and baby. For the Bailey family, a positive breastfeeding experience meant finding the balance between what was best for baby and what worked best for mom. We wish all of our new moms and babies a good experience. You can learn more about the Center for Breastfeeding Medicine and the Mother's Resource Center on our website. It's medwatch.communitymedical.org.